Dozens of leaders from across both Ontario and BC Health recently came together trying to find new ideas for how to solve Canada's access to care challenge. It was the THINKsummit Access to Care series presented by Petal Health. And the goal of this brief is to give you a quick insight into the series and some of the key learnings. And we'll follow this up with specific briefings on the Ontario Summit and the BC Summit, as well as a quick briefing on how all of the learnings impacted our thinking and our formal thesis on Healthcare 2030. But at a high level, there were three actionable ideas that kind of permeated the whole series. One was this notion that we're not aligned on what success looks like when it comes to access to care in the first place. And we really need to be, because how are you going to succeed if you're not all aligned on what great looks like? The second, which was related, is that you can't possibly make system-wide improvements without system-wide visibility into the gap between demand for care and the ability to deliver care. To give you an example into this one of the discussions that really resonated for us was this idea that we keep measuring things that don't matter. And specifically, one of the thoughts on this was like, everybody's fully focused on this notion of primary care and attachment, but that doesn't actually equal access to care. It's important, it's a great tactic, but we're measuring that like that's what actually matters, when in fact, when it comes to access to care, that's just a tactic, not an outcome. The third, and it kind of relates, is the notion of scale. That care delivery is hyperlocal and technology requires scale. And we seem to squander the scale that we have by doing things across all the provinces instead of just one time, by pushing things down to teams and organizations that don't have scale. It's a critical piece of the puzzle, and we keep ignoring that lesson. So those were big ideas, and then there was 5 actionable ideas. Well, really, there was more like 150 actionable ideas, like really good actionable ideas. But these 5 are worth mentioning because they resonated across both the events. 1, require demand data. If you don't have visibility into the amount of demand, how are you possibly going to close the supply-demand gap? 2, adjust funding and remuneration to align with however you defined success for closing the gap. So define success and then adjust how we fund things and remunerate. 3 and 4 are related too. Stop pushing responsibilities for things that require scale onto teams and organizations that lack scale. And let's get rid of these interprovincial barriers so that we can achieve better scale instead of squandering it. And finally, we need to embrace public-private collaboration to measurably reduce demand. You can't afford to solve the gap between demand and supply just by adding capacity. Reducing demand is a critical lever. Well, that's a real high-level view of the series as a whole, and we'd like to thank everybody who participated because there was absolute candor in these discussions. This wasn't your normal event. People didn't come as organizations pushing an agenda. These were individuals who were free to share their personal experience and opinions across their entire career. And there was absolute transparency in the discussions, and we're grateful to everybody for agreeing to share all of the artifacts under Creative Commons license so that others can access everything that was talked about and use this in any way they see fit to try to help solve the access to care challenge. Quick reminder, we're going to follow this up with more specific briefings on the Ontario Summit and the BC Summit and our healthcare thesis, and that the full detail from all of the Summit series is available at thinksummit.ca. That's it for now. Thank you for your time. Have an amazing day.